October 2020 it is. Good morning and welcome. This is KBC News Check. My name is Njue, and Anne Wangeshi will be our sign language interpreter for this program. Well, you will agree with me that in March of 2020, the whole world and Kenya as a country, we were grappling with the new unseen enemy, that is the coronavirus pandemic. And of course, it's changed the way we do things, the way we do business, and of course also actually, let's say, entered all our social circles. And at least we have been able, because of the vaccine and of course the austerity measures that have been taken by Kenya and other countries, we've been able at least to manage the situation. That is what we're going to be discussing today. What are the socio-economic impacts of the COVID-19? Exactly a week ago, the head of state did ease restriction and of course was welcomed with open hands from all sectors. Of course, opening up the economy by declaring that the curfew that had run for almost 2 years was coming to an end. Of course, we are registering 1%, 2% of the positivity rates. That is a sign of good riddance. And of course, a lot came with the COVID-19 pandemic. How are we going now from where we were? How are we going to get back to our lives? How has it impacted on our socio-economic and of course on our mental capacities? That is a conversation that we are going to be having, and right now I'm joined in studio by Dr. Leonard Njue, who is a psychiatrist at the Kenyatta National Hospital. He's also a psychiatrist at the Madari National Hospital, and of course he will be telling us more on what he does. And on my extreme left, we have Newton Ogada. Newton Ogada is not the first time that he's been here, and I do remember we hosted him when the pandemic had really hit us. Newton Ogada is actually a philanthropist, and he has been helping people and the vulnerable since before the COVID-19 pandemic hit. How has the situation been? How are we supposed to pick up the broken pieces and join them so that we may be able to actualize our normal life? That is a discussion we are going to be having. Remember, you can be part of this conversation via all our social media platform. At KBC Channel 1 is our Twitter handle. And of course, for comments, suggestions, or even where you are watching us from. Of course, we will be from time to time heading to some of the functions that are currently happening to just check on what is happening in the country. A lot mostly is bended on matters politics, but each and everything, including socio-economic ones, we will be able to visit them and see what exactly is happening. So, gentlemen, karibuni sana.
Thank you. Thank you very much.
Yes, and perhaps to start with you, Daktari, how has the COVID pandemic hit hard, and especially when it comes to people with mental illnesses? Because at the end of the day, the COVID pandemic has come up with a new challenge. A lot of people have been mentally affected, but there were people who are having other conditions, including mental illnesses. How hard has the pandemic hit?
So thank you very much, my good friend Misheni, first for having me here today, join you in studio to discuss this poignant and very important issue that has afflicted our society, and in fact has affected each and every person in one way or another. You bear me witness that our world today and our world in the past has experienced very many different kinds of catastrophes, disasters, bad situations that actually have a big impact on how us do our things day to day.
Indeed.
In Kenya, in particular, we have had various situations: the bomb blasts, the terrorist attacks. Occasions and again, we have famines, disasters, road traffic accidents, and all that. And when these things happen, they have an impact on the psyche of the society. How? First, they affect how we think, our levels of happiness, our levels of productivity, how we do think and feel about the world around us. And that is exactly what the COVID-19 pandemic has done to us. Because we woke up one morning and we are told that there is a virus that has happened in Wuhan, and this virus is spreading throughout the world, and we have to be on a high alert. And then gradually we hear news of how it's spreading in China, it's spreading in Europe, it's spreading in the Americas. And you bear me witness that the day that in Kenya we got the information that the first COVID-19 pandemic has happened, each of us was,
in March last year,
each one of us was caught by, pangs of fear and apprehension and uncertainty. What is going to come out of it? And you see, gradually with the lockdown and the restrictions that were put in place and the quarantine and everything, we were in a situation that even us, primarily as healthcare professionals, we did not know in particular what are we handling. It was a new circumstance that we have to wake up to and know how to respond to. So as a healthcare professional, we had to give answers to our society, to our families, to our friends and colleagues. And then as a society, the Kenyan people had to adjust to a new way of doing things. With the lockdown, the curfews, the working from home, all these things disrupt our day-to-day life.
Indeed.
And what effect does that have on us? We have to change, working from home, working online, old people don't go to places of work, minimizing contact, social distancing, wearing masks, and all these situations.
We were just observing them, not knowing that they were really affecting us psychologically.
Indeed, they did affect us psychologically, because we have to find ways of living through this situation that we did not know about beforehand. And because of all these effects on how we do things, on how we think, on how we feel, there is a high likelihood of now us getting feelings of anxiety, apprehension, stress, because we have to stay indoors with our kids, throughout the day. We were used to them going to school. We have to stay at home and, live with each other. Sometimes we would see each other in the morning, and then later on in the evening, now we have to spend all the time at home. And then also because of the impact on our livelihoods. Sources of income were affected. Businesses were closed down, where we get revenue. And
actually the economy, sorry to cut you, but actually the economy was not doing very well. And now we were having another bigger problem. So mentally, there were some people who had been affected mentally, and now the COVID-19 pandemic. Did it aggravate the situation?
That aggravated the situation. You'd say, well, it was a domino effect. One block fell, hit another block, and gradually we have this situation escalating from good to us. Bad. Okay. Of course, we're going to go to the specifics on how it affected and how we can try and get ourselves from this deep hole. Newton, the last time we were with you here, we were talking about how things are tight, and especially when it comes to matters philanthropy, because at the end of the day, even the people who actually assist you to assist other people were also grappling with the same problem that we were as a country. How are things now? At least the COVID situation has a little bit eased. How is the situation?
First, thank you for inviting me again.
You're welcome.
To this station. I want to thank the organization here for always thinking about me to come and we discuss what's the situation in the country. The situation is still bad, it's still worse, because in Kenya here, I think the president announced 3-4 days ago that now he opened the country.
Which today will be the first week.
The first week now.
Wednesday, yes.
So if you compare 1 week after 2 years, that actually is nothing, because everybody is trying to wake up or catch up with the life. And again, what I can say about this is that this is a lesson to the whole world, more so to the country Kenya, because we saw that we were not ready to fight with anything coming abruptly, because nobody knew that there will be something like COVID in the country, and the economy was really bad even before the COVID. So before the COVID, the economy was bad, but things were really working day by day. But now, being the COVID came in again, it makes it so worse. To what we are doing at the ground, like supporting people, taking care of the children, and even doing the medical outreaches, we have been receiving some quite money from America. But now, being this thing happened to the entire country, it is not easy. It is difficult.
Yeah.
It is difficult the other side. It is difficult this side. So what I can say about it is that we as a country before we look into those who are supporting the country, because we don't have any private person in the country. We all belongs to this country. The government should think of, or all of us should think of, how we can have some emergency money set aside for such kind of situation. If you go back to the village, because me, I always work in the village with people all the day, all the night, you will find we have some poor families who does not even know about the COVID. Even before COVID, they could not manage to feed themselves well. Even before COVID, they could not manage to take their children to school well. But now, being the COVID came in, actually this thing entered to their brain. Some, I'm telling you, it's only that we cannot know how many people died because of the, not because of COVID, but because of the mental issues.
Yes.
Because when you think about it, maybe in a family, there's only one person who is a breadwinner, and they lost the job because of COVID. And then background of everybody, there was nobody again to be looked into. So it is not easy as we speak. We are still struggling. We are still having issues. Even now as I speak, when I talk about health, there was a certain young girl who was actually defined and thrown into a forest called Kodera Forest. She was being found with security who were patrolling in the forest. After she has stayed there for 3 days, she was almost dying there. And she's now taken to Rachuonyo District Hospital, sub-county hospital. And even there's no enough medicine, there's no medical equipments. They only have the doctors and the nurses, but there was no materials. So just imagine such kind of a person. I only talk about one whom I know because I'm taking care of that girl as we speak. I'm sponsoring most of, maybe 90% to support her. What of the cases that we don't know? We have some people who just die because nobody is there to stand in to fill the gap. And there are very many. So we're still approaching difficult situation because of COVID.
Yes.
Yeah.
Indeed. And Dr. What Newton is saying is quite valid because of the situation in the country and when it comes to mental illness. Do we as a country, should we give more preference and attention to mental illnesses and conditions now that we have a wake-up call of COVID-19? Because even the president himself did say that this is headed towards deeper waters. So we need even to set up a commission or a task force, for that matter, to investigate exactly what ails Kenyans when it comes to mental illnesses and attention.
Very good question, Mishani. And first, I thank our president because if you remember clearly, when having one of the national holiday celebrations in Narok, he actually, for the first time in the history of this country, as the president acknowledged that actually mental health situations are significant and an important function, or rather problem, that the society is facing. And out of that presidential declaration in Narok, the president actually directed that we needed to have a mental health task force be set up and go out into the country and find out, go on a fact-finding mission to know what is actually happening on the ground. What is the situation of our mental health services in our country? The task force accomplished its purpose and actually gave a candid and elaborate report about.
Perhaps you can touch on a few of the things that came up in the task force.
Exactly. One of the poignant points that came up is that our primary health care needs to be strengthened more than it is now to be able to handle mental health situation at the community level. Newton has commented that we have that person deep down there in the village who has problems accessing primary health care. What about accessing mental health care? So that is an issue that needs to be addressed. How? First, by investing in the provision of mental health care services deep down in the grassroots of our society. Two, we need to strengthen our referral system. Because, well, unfortunately, we don't have adequate human resource for health and specifically for mental health care. How? The number of psychiatrists that we have in the country is not adequate to meet the population of Kenyans.
And especially now.
Especially now. The ratios are not very appealing. The number of other auxiliary mental health care providers is equally not sufficient. So these are findings, among others, that the task force actually brought to the table and made very clear and candid recommendations about how the country, the Ministry of Health, and the different county governments can now put in concerted efforts to actually build capacity in the provision of mental health services. So that. And then, of course, the Ministry of Health has been on the front line. We thank the Minister, the Cabinet Secretary, and the entire team that has been actively involved in actually addressing this situation. We have seen Mutahi Kagwe actually coming out into the open and actually saying that here we have a situation that needs to be addressed. We have seen our Cabinet Secretary and the Cabinet Assistant Secretary actually talking candidly about these situations. So yes, our government has been on the front line helping, and the efforts need to be actually concerted and more emphasis put on it.
And Newton, perhaps to lean on what Dr. is talking about here, you are in the community, you are on the grassroots, and looking at the situation, how was the situation be? Because at the end of the day, the protecting the vulnerable, you have a healthcare institution that helps not only the vulnerable, it also helps other people. How have you seen the situation when it comes to mental illnesses, and especially now that we've had COVID-19?
The truth of the matter is that we are failing to reach out the mental cases or our mental people in the community. Most of them are being hidden in the houses because nobody is there or ready to take care of them. Being I'm working in the community, I'm working in the households, we have a number of mental cases who nobody knows they exist in this country. And I appeal the way he's saying really things that are touching the people down there. Like, for example, the case I'm talking about. When I met the girl, she's kind of maybe somehow mentally affected because of what happened. A 12-year-old girl, when she's being raped or defined, you know, that situation. And we have those who are being born with the mental cases. And I don't know how the Ministry of Health has been reaching out the people, because let us speak the truth. We have some households who don't have the TV or the radio. They cannot reach. They cannot understand what the minister or what the Ministry of Health has been telling people in the TV or in the radio stations. My take to this is that we need, as a Ministry of Health, because I'm in the health institution too. I'm running an hospital. I've been doing a lot of medical camps, outreaches, reaching the people in the ground. What I'm pushing, what I'm requesting the Ministry of Health to take is just to make sure that we have enough people in the ground who can actually reach to the people, to the household, because, you know, in the community we have the community members, we have the leaders, the community leaders, we have the chief, we have the village elders. If you can have a health people who can actually be delegated to know and give us the number, because even if I ask the Ministry of Health today how many mental cases we have in Kenya, the answer will not be correct, because we have those who are there inside, nobody knows about them. So what I'm trying to say is that if you can work with the government, I think the county government is failing on health. If we can work with the national government in this, then we are going to succeed. Most of the hospitals, as we speak today, they don't have medicine. They don't have materials that can enable them to treat our patients rightly. Doctors talk about the transport system to the health facilities. It is really poor. We have some health facilities that there's not even road going there. You can only use motorbike or bicycle. When there's emergency, sometimes it's difficult for the vehicles to reach and do the transfer to the other referral hospital. So in health, you know, in the life of human, we have only three things. We have church, or mosque, for those who are going to mosque. Then we have health, then we have education. What we need to think about is only the three things. The school, we have mental cases at the school, and sometimes we cannot manage to take all our children to mental schools or special schools, you know, because they are even few. We don't even have them. We have few. The Ministry of Education brought an idea of having one class for the mental issues, the special class. but it's only from preschool. We don't have it from preschool to class 8 or to secondary level. But the ones that we have are few. They are not enough. So they are being congested with the similar cases. So what we need to do as a government or as a country, we need to focus on 3 major things or 4 major things. We need to focus on water when we want to deal with health. We need to focus on health, which covers everything, and then with education. And then the country will be in a level where we can manage it. When the pandemic came, the Minister of Education announced very clear that now the classrooms that we have is not enough for our children.
Yes.
My question, how many do we build after the announcement? Maybe none. We announced that we need to have masks because of the health situation. We must go get anything related to health. Do we have enough as a country? We did not have enough as a country. So whenever we come to the TV like now, it is the best platform to speak what is in our mind and what is affecting the people in the grassroots. What is affecting the people there is that we speak a lot as the government, but we do less as the government. That is my take about it. Because what if now, let's just say, I'm not hoping it to happen, if we have another pandemic again apart from COVID, where are we going to go? Where are we leading? Where?
Actually, a good point that we were caught flat-footed by the COVID-19 pandemic. But actually, just as Newton has said earlier, the vulnerable are worst affected when it comes to pandemic and even other factors. A good example is what he's talking about. It's quite hard to know what the vulnerable are going through mentally. How can we reach these people so that we ensure that we have been able to identify the needs that they have, and especially mental, and how do we get them out of that? Now that at least COVID has a little bit eased up and things are starting to look up.
Good point, and I'm happy that my co-panelist Newton has brought up a very important perspective to this discussion. That this is a systemic situation, and it needs a systemic way of thinking to address the circumstances that we are facing. How? A pandemic like COVID affects virtually every facet of the society. Education, health, manufacturing, entrepreneurship, businesses, they have all been affected. And so to find the solutions, every piece of the society, every spoke in the cog and the wheel needs to actually be well fixed so that the wheel of our society can roar. About the questions that you asked, the vulnerable in the society, and in particular, those that are suffering mental health illnesses. How do we identify them? First, I'll bring up a quote that was made by one of the first presidents of the United States. Should be J.F. Kennedy, if I'm not wrong. He said, "Ask not what your country can do for you, but ask, what can I do for my country?" So I feel that each and every Kenyan needs to have this wake-up call with regard to mental health illnesses and the vulnerable in our society. How? Specifically about mental health illnesses, one of the things that deeply and heavily impacts those who are suffering is shame and stigma. Shame by the individual that they are going through a situation, and then stigmatization by the rest of the entire society.
Yes.
You know, because someone is going through this situation. And what comes out of it, you will go to some families because they have a child or a person who is suffering mental illness. They will feel ashamed and they want to hide. We have had situations that are brought up that they have chained children with these disabilities with chains in the house, in the bedroom, and they are staying there, you know, and they are hidden from the view of the rest of the society. We need to find a way to have this conversation. It's not normalizing an unfortunate situation, but actually opening up and accepting as a society that this is a problem, and not being ashamed of it, but instead of being ashamed, seeking help. So when the person in the grassroots is able to open up and come out that we have a sick person who is suffering a condition, who is vulnerable, then the likes of Newton, myself, you, and the people of goodwill in the society will be able to come out and help. Because you bear me witness, we have people of goodwill who are ready and willing to help. But then if the problems are not brought to the fore, well, it will be compounding an already bad situation. Then to escalate it upwards now, we need systems by the government. Our government needs to put more investment in health, more investments in mental health care. We need more budgetary allocation. We need more investment in healthcare facilities. It's true what Newton has said and what the data says, because, well, we need data to know what is the situation on the ground. The data says that we don't have adequate healthcare workforce. We don't have adequate supplies in the healthcare facilities. So when people go to the hospital, sometimes it's quite unfortunate that they have to go and purchase their medical supplies from elsewhere. These are situations that should not be happening in our society as at now, when the world is talking about, sustainable development goals. Economically, what are we doing to ensure that the per capita allocation from the budget to each and every Kenyan is adequate to meet the basic minimum healthcare needs? So the government needs to think through this, especially around the budgeting process, the allocation of resources, the development projects that go on, so that our hospitals are done well. And then in the grassroots there, because that is where people are, Newton brought it up, we have community health workers. We have community health volunteers. These are formal mechanisms that have been put in place by the Ministry of Health to enhance and to foster community health care. Now, these people who are actually immediately in the society, they are interacting on a day-to-day basis. They know each and every household. They know how are people feeding in the communities, how are people's health status in the community. These people need to be strengthened. Give them an enabling environment so that they are able to actually go to the grassroots, go to the households, identify, this child needs help, this old person here needs help, because we might think so much about the children, but on the other end of the spectrum, we have the old and the elderly and the disabled. Yeah, well. So even those need to be taken care of. And because, well, we will not have the Minister of Health coming from going to the grassroots, we need to identify those people with the help of the local administration, the chiefs, the sub-chiefs, the village elders. So when now these concerted efforts scales upwards, we will be able to generate data that is representative of the situation on the ground. We are able to implement remedial measures, implement systems about how now to direct help to those people.
Indeed, and you can add on that, Newton, the vulnerable. You've been dealing with the vulnerable for years now. What safety nets should we invest in to ensure that the vulnerable are protected and empowered, just as like Doc is saying?
Yeah, I've been thinking about it because now we are in election year. I see all our big politicians running around campaigning for their votes. They are telling people to register for the votes. They are now telling even the mentor people to be taken to the registration so that they can vote for them. But I've never heard any of them talking about what they are going to do with the mentor people in this country. I've never heard them talking about what they're going to do for the widows in the community. I've never heard any agenda talking about how we're going to reach out the people who cannot manage. Let me tell you, we have 80% of those who are mentally sick and vulnerable dying because of a simple disease as malaria.
That's right.
We have 90%, if I'm not wrong, because they cannot access to any health facility. Number one, because they don't have the money. Number two, if they go to the public hospital, there's no medication. They are being sent home to go and buy some medicine from somewhere else. Number four, they have not been reached in a way that the government can offer them the NHIF. It's only 500 shillings per family to enable them to reach and to go to any other better hospital where they can get treated. But the agenda in Kenya is politics. The agenda in Kenya is talking about four big agenda. The agenda in Kenya is how we can beautify our country. But nobody is out there to talk about these vulnerable people, how we can reach them. Previous days I heard Raila saying he will give 6,000. That is not enough. What is enough is how can we reach them to make sure that they have health care services and cover, so that whenever they are sick, they can actually walk to get treatment in any hospital where they can manage to reach. Number two, we have been neglecting the poor or the vulnerable in the community in this country. We only talk about the business community, the business people. We don't talk about things that actually they are good if we talk about them. But we are living, by the time we are getting the leadership in this country, we don't only lead for those who are able or those who have a class, but we are leading each and every person. My first question to the conversation was, do we have the data telling us how many, for example, me, I'm coming from Homa Bay, how many vulnerable people we have in Homa Bay County? There is no that data anywhere in the world. Even if you've been asked, maybe the number that will be given is quarter of what is happening in the community. If the way the doctor said, if we asked today, how many mental cases do we have in Kenya? Apart from those who, their parents or their guardians have actually tried to reach to various or their hospitals to tell what is happening. We have a number who are just in the bedrooms. Nobody knows their cases. And thereafter, the Ministry of Security are there to walk into their homes and even arrest their parents or their guardians if they are doing something which is not which is against the law. But we have never think health-wise, what can we approach these cases? Because there are people, they have their portion in the government of the Republic of Kenya. Yes. There's a portion. They have their birth certificates. They have their birth identification. When we talk about the number in this country, even if it is 40 or 50 million, they are being counted in the number. When we are looking for funding outside the country, or when we are taking loans, we are taking loans or we are looking funding, cover even them. But when the money comes to the country, when the project comes to the country, they don't get it. This is why I was saying, if you go even back to your home village, how many schools are built for the special cases? You might find in the whole county there are 10. But the population is more than 10 schools. You see? So there is a portion of health that we forget in the country. We only talk about Mama Mboga, Mtu wa Jua Kali. We only talk about those who are going to give 6 million or 6,000, wherever. But we are not talking about the country called Kenya as a whole. We neglect a section. But this is not the problem for our big men. This is the problem under the Ministry of Health, because they have the power to push. I like the minister who was pushing about the COVID, Mutahi Kagwe. He was really working on that ministry. Yes. If he can take that pressure again to know people individually in their homes through his arms, because the government has arms. Yes. We have district hospital, we have sub-county hospital, we have like even, how do we call them? These small dispensaries. Those are the arms of the Ministry of Health. We can reach these people if you have been given that chance. Or if there's somebody who's sleeping in their job, those who are down there. But if we reach them now, I'm talking to this new government which is coming after 2022. If they can actually sit down and have a talk on the health issues, yes, on the mental cases, on the poor people in the community, on the widows who are there suffering, on the single mothers. We have many single mothers who are not even married and they have children. They have 4 or 5 children. If we can have a conversation talking about them, then now the whole country is involved in all the problem we have in this country. But for now, we have a loan to pay, right?
Yes.
We have a tax to pay, right?
Yes.
What is covering those people? There's no 1%. I've never heard anybody talking about 1% covering those people. I've never seen. Indeed. I've never seen even the hospital. We have only mental hospitals, are very few. Me, I only know Mathare and few of them.
Of course, Doc is going to
talk about
exactly,
that.
What goes on there. But still on the same, Doc, perhaps you can chip in with this one. We're talking about the vulnerable. We're forgetting that our kids are also vulnerable, because it's quite hard for a kid to know that he has been affected by the pandemic. It's quite hard to diagnose a kid as compared to an adult. How do we balance this so that we may ensure that we also incorporate them as we wake up with the COVID-19 easing up?
Okay, very, very, very pertinent issue. Our children,
yes,
and especially the young, and even the adolescents. Bringing up a child is not an easy task. As a parent, you bear me witness.
Yes.
And then having this child go through difficult circumstances makes the situation even worse. So with regard to our children, our Kenyan children in our homes, how has the situation impacted them? I have kids in my home. I know how the situation was, how difficult it was to explain to them, tomorrow you are not going to school because, well, the country has been locked down, now you will be staying at home. And then they are seeing mom and dad are not going to work, so we are spending the whole day in the house with them, you know,
a new normal for them.
A new normal for them. There were very many questions. The interesting thing is that children sometimes go through situations differently from us adults. They are able to adjust, you know, get into a new system of doing things, get new games, you know, make friends in the village, mix with each other. And actually there has been anecdotes going on that the COVID pandemic to some extent has been good for our families, for us parents to bond with our kids.
Yes.
Because we got to spend more time with them at home. We got more time to do homework with them. We got more time to go to the shamba with them, show them how to hold a djembe and a panga, how to look after chicken and cows and goats. You see, that was good. In fact, I feel it was very good. But then we know they have to grow, they have to go to school, which we know was affected because there is social distancing and our classrooms are overcrowded, and you know, we have to find a way of decongesting.
And the kids are so touchy.
And the kids are so touchy, and their numbers are many, which is good. But now, how do we experience and how does the government address these issues? First, we have to agree that we have come from a setback. You know, COVID itself has been a setback to us, socially, economically, financially. And now, we have to make a comeback, you know, from this. We have to find a good way to segue from the setback to the comeback. And that is exactly where we are. We are not yet out of the woods as a country, as parents, as the government. And it is at this situation which is this situation is a make or do or not do, you know. Find ways of getting the kids back to class. They are adjusting to the CBC curriculum, you know, and all. So the children are actually going also through a difficult circumstances. And it needs prudent decision making by everyone that is involved to protect our children and make them grow well by providing for them, of course. And it boils down to what policies have been put in place in terms of healthcare provision for the children. If you have been keen, you will notice that vaccination has not been very heavily directed to the children.
Yes.
Science is still evolving. We are getting more data. We are getting more information. We are getting more guidance from the scientific community. Do we vaccinate or we don't vaccinate our children? So the healthcare domain needs to give us direction about this. How do we handle our children and the COVID pandemic? And then, of course, there is the effect of the disease itself on children. We don't have sufficient data as yet to know what has been the effect on them in terms of the COVID pandemic. And then now, in terms of mental health, our mental health situation, it's a function of our nature, you know, and our nurture, the environment in which we are. How has this particularly impacted our children? So we will need data, like my friend is suggesting, to know what has been the effect in the community of this pandemic on our children, on the adolescents. You know, have the levels of stress went high? You know, have the levels of depression went high? Have the levels of anxiety increased for our children? You know, For the adolescents, is there an increase in abuse of substances, you know, because of exposure, because of peer pressure and all that, you know? For the young people, is the idleness impacting them in a bad way? So it's an entire conundrum.
In short, a parent has to be very, very vigilant to observe what the kid is going through each and every day, perhaps to identify if there's something wrong.
Exactly. So the aftermath of the entire of this situation, in terms of our health status, in terms of our mental health, it is an evolving situation, and we need the data. You know, we cannot dwell on hearsay. We need actual data, like my friend Newton has been insisting, to know what is the situation.
Indeed, and Newton, still on the same, on what Doc is saying, is that you do support a lot of people, and majorly, you have an orphanage, home.
Yeah.
Were you able to pick out some of the issues that, of course, were happening in the orphanage that normally wasn't going on, and identified that also these kids have been, in one way or the other, affected by the pandemic?
Yes, because, for example, being I have an orphanage home, I'm running a home, there's a lot of challenges, even for the children who are living at the orphanage. Number one, they see things are not normal in their lifetime. Like if I talk about a little bit of education, you know, we lost one year.
Yes.
And the Ministry of Education is trying to cover up that 1 year in 1 year. So you will realize that now we don't have holidays that the children used to have, because we used to have 4 weeks, 3 weeks,
and now we are
5
piling
weeks.
more pressure.
Now we are piling more pressure on them to cover the syllabus within the term. So one term actually have 2 terms.
Yes.
This is another challenge to our children, because they were not used to it. You know, the brain of a child needs a break of playing, a break of doing other things, and now then they come back again to learn. Number 2, this CBC, it's good because I'm running a school and I understand how it is difficult. The CBC came, it's a good idea for, to the Ministry of Education that they brought, but it was like she was born before time. She was born before time.
Mature a bit.
It is not mature as we speak. The government could actually wait. They first practice it, bring it slowly, understand how our teachers are going to use the curriculum and mix it and make our children learn. For example, most of private schools has no books for the CBC, the textbook. They only give the textbooks to the public school. This brings something in my mind, that under the Ministry of Education, we have private Kenyans and Kenyans. You see? Number 1, I have my own school with where my orphans are going to. These orphans, they are there because they lose their parents. That, number 1, affected their mind psychologically. Because they are there and they see some people with their all parents, and then they don't have their parents. That is number 1. Number 2, now they cannot get the books for the CBC. That is number 2. I have to make sure that I source it, because the books are not published in any bookshop that you can go and buy. And the ones that are in the government are written not for sale. That's a challenge to these children, because they don't know now where they belong to. If they belong to Ugandan country, or they belong to Kenyan country, or they belong to who. Number 3, they have challenges like adolescent stage. Everybody pass there, and our children must pass there. If there is nobody, because this now I'm talking about the ones whom I'm covering at the orphanage, there are a number who are not covering in any orphanage home. They are living with the grandchildren, with the relatives, who somehow are not taking 100% care of knowing that we have change of human life. This is the number which are having been affected with early pregnancy, infected with HIV/AIDS, infected with other diseases related to sex, and nobody is there to talk about it. So it is a big challenge to the children who are orphaned as we speak, And it's a big challenge to those who are running homes, because even we need to receive some funding or some food from the government to support these orphans. But let me tell you, there's nothing coming from them. So which means if I fail, then this child is again having another problem. The another problem that I always see, even though we are giving 90% of what we can, they still think about their family. They still think about their parents. So you can give up to 90, but it reaches a situation where now they are satisfied with what you give to them. But there's a question, why did my parents die when I'm still young? That's another sensitive question that comes to their mind. I have a number that because we have a break. When we have a break, I used to take all the children back to their guardians. Because, you know, again, there's another big challenge of land issue. If you take a child for 8 years, when they will go back, they will find now they don't belong to the family, they don't have anything. So in every break, I have to take them back to their guardians. Number one, to cover. Number two, to see their grandparents. But some has no place to go. So I always take some to me. They belong to me now. So the bigger challenge again that we see, we should work on this. I don't know how it will work. That the Ministry of Education can actually organize a social talk to all the institutions, public and private institutions, and even to the orphanages.
Perhaps they can increase the number of counselors?
Yes, that's what I'm coming to. We need to actually add the number of counselors. We need to know where the offices are. We need to have their numbers, in a way that now whenever we have a need, we just reach them and they come and they give counseling to our children. Those are the facts that we need and we are missing in agenda that we have as a country. If we can have all this, you know, the problem, my brother, is that Kenya is a fast-growing country. We know that. But number two, the people in the country grown so fast than the economical growth. So we are almost 60 and the economic growth is almost 20. So the gap is so big. When the gap is so big, now you and me have to feel it. Because this world of computer, we have reached the world. You can Google and see the world. But you personally, you have not reached there. That is what is killing this country. Apart from the economy that is really bad. The economy is bad because we think big than what we have. Can I take you a little bit to our neighboring country, Tanzania?
Yes.
1 minute.
A minute, yes.
1 minute. If you see the economy now is growing stronger than the economy of Kenya. Number one, because the late president there said, before we go and look any other support from any other places, let us start to utilize our resources. Number one, for us to help these poor families or to reach out these the people who has need, we must ensure that this country has light industry, that we can manufacture our own products. Then from there, the country will grow and catch up with the economical status. You see, when we get there, now there will be possibility of going back to the community and support a vulnerable family or in taking one of their family members to give something to do and bring. By the time we're doing something as a country, 70% of people are working, even if there's small money coming in. Then now the tax will come in. When the tax come in, the tax now will pave the roads, the tax now will buy the medicine, the tax now will give us the clean water, and then now we are going to grow, and all this problem actually will not be there. And the tax now will actually build other health facilities near to the people.
Yeah. Okay, and Doc, perhaps to strengthen what Newton is talking about, when you talk about education, of course, our kids are vulnerable because they actually depend on us on almost everything. Looking at the COVID-19 pandemic, and then looking at, of course, the new way of doing things. Of course, we have been rushing, or as Newton says, all the curriculum, a week holiday, and we still they have to go back to school. Their brains are growing. They, of course, affected by the COVID pandemic. Is it an added pressure to our children, especially mentally?
Definitely.
To digest all that in the midst of a pandemic?
What happens with children,
yes,
if you observe from a very young age, is that they are in a period of rapid growth. Growth physically, growth mentally, growth intellectually. And the environment needs to be set up in such a way that the needs of these children are actually met when they should be. So when a child is 1 year old, needs the presence of the parents, for the emotional attachment, for the emotional growth, for the intellectual and mental development of that child. Research has shown that close proximity between the mother and the child, the father and the child, is very important, which is where my friend Newton comes in. He's handling orphaned and vulnerable children.
Yes.
So from the outset, the circumstances have already hit them hard.
Yes.
What about every other child? And then now we have the COVID-19 pandemic, and children, and the circumstance of our specific education system in Kenya, which is actually going through a change both for the children and for the parents. If you follow the discussion quite closely, you will agree that there have been questions about how ready are we as Kenyans and how ready are the teachers to actually take this system and take our children through it. As parents, everyone wants the best for their child.
Yes.
So it is very important that these issues are addressed. I believe there are good points, and maybe there are also weaknesses with the CBC system,
yes,
which is what is being implemented now. It's already in a number of years in operation, and I doubt whether there is much that can still be done to reverse what has already happened. So how do we address the situation as it is now? One, the government, the Ministry of Education, needs to actually make a concerted effort to get buy-in from the parents, make us understand what are the children going through and how are we prepared to actually take our kids through this.
Yes.
Because it is an issue that affects each and every parent, each and every single day. When I see my son coming home with homework, when I see reports from the teachers, when I see a new system, which is actually foreign to me, because that is not what I went through.
Yes.
I went through the 844 system with all its strong points and the weak points. It made me who I am. It made you who you are.
Yes.
That is what you are psychologically aware about.
Yes.
But you're not psychologically aware about CBC. So as a parent, he needs to be prepared. I need to be prepared. You need to be prepared. Every Kenyan parent needs to be prepared about it and enlightened about how to handle it. And now with regards to the intellectual, moral development of our children, it is very important that these things are inculcated in the system. And then the resources are veiled. He mentioned a point that it's as if we have a private and a public system in our environment. Thinking about it, well, I feel it's the nature of our capitalistic society. Quite unfortunately, our foundation as a nation probably was not as socialist as what the late Julius Kabarage Nyerere was able to establish in Tanzania.
Yes.
From whom we can borrow a riff about how they do their things,
yes, and
improve our systems. Thinking through it, it's about politics. Yes, politics is very important. We cannot escape from politics. I feel that everyone plays politics in their own way. When you wake up in the morning and you make a decision to brush your teeth, to get out of bed,
yes,
to what kind of shoes you wear, what color of clothes, what suit do you wear, you're actually playing politics with yourself on a micro scale.
Yes.
Then this politics then is scaled up to the decisions as a country we make. Where do we put roads? Where do we build a school? Where do we build a hospital? There are decisions, political decisions that have to be made. And how do we make good political decisions? It's by having good leadership and good politics. We get good leaders into those positions. Well, we will say as Kenyans we are recycling the same leaders and everything about that. But then how do we go about solving that conundrum, that difficult circumstance? Maybe we need to enlighten our citizens. our people about how to make good choices and ensure that there is equity, and an opportunity for us as Kenyans to determine ourselves, to make the correct or the right choices of who we want to lead us. Because you bear me witness, as a medical practitioner and as a psychiatrist, I can mention counties. Go to Makueni County with Professor Kifudha Kibwana. That is a model county where the mental health care services are actually working for the citizens.
Actually, the mental health, the health situation there is quite enviable.
Quite enviable. What magic is Kifudha Kibwana doing in County Makueni that, another governor in another county is not doing? What are the ethos? What is the approach to leadership that Governor Kifudha Kibwana is implementing there so that their system is able to run and work for the common mwananchi? Maybe he's not a self-seeking politician. He went there to serve the people. So how can we change our politics in our country so that they work for our people? So it's a very important discussion. It needs an enlightenment of the people as Kenyans so that we get good readers. But then back to the question about our children, we need systems that are working for the public, for the private, for the vulnerable. We have systems for the protection of children with special needs. We have approved schools. We have a ministry and a department that is responsible for handling children with special needs and all that. And also we have some system for social protection of children. We have some constitutional processes that are followed in case, a child has been neglected by the father, the mother, there is the office of the children and all that. These things need to be strengthened because we might have very good systems on the paper, but then the implementation is not very good.
Indeed. And just in case you joined us, this is KBC News Check, and today we are looking at the socio-economic impact of COVID-19. Of course, it affected all sectors of the economy, and some people are even disturbed mentally, but they don't even know. But because of the pandemic, now that we are starting to rebuild after cases, of course, in the whole world, there's vaccination, cases coming down, and of course, economy starting to open up. It's exactly a week since President Kenyatta, of course, announced some austerity measures, including injecting some money into the economy. But at the end of the day, we still have the COVID-19 pandemic, and it has affected all of us. And of course, I am with Dr. Leonard Njue, who is a psychiatrist at the Kenyatta National Hospital and also Mathare National and Referral Hospital. And we have a philanthropist who is Newton Ogad. Of course, we are also live on social media, so for comment, suggestion, or even where you're watching us from, we highly welcome that. Perhaps, guys, we can look at the social protection which has been exposed now that we've realized we have COVID-19. That's where we are seeing a lot of loopholes, some of the things that we were not able to do or we should have done. Newton, can you kindly touch on that? Because we have a lot of vulnerable communities. We have the elderly, we have people with disabilities, we also have informal workers, and we our social protection as a country and also as a region is quite wanting.
The challenges that are still there, we cannot run away and we cannot hide, is that we have been told on social protection or coverage, how we can actually be social protected, but we have not given the materials. For example, a 70 years old woman who is a widow with orphans at home, you are telling such kind of a person to protect herself due to COVID pandemic measures, which is actually true and right. But this lady is suffering of eating something in the evening. This lady is suffering on how the grandchild, who is actually an orphan, will go and get education. It was a good move of telling and for us to be self-reliant on protecting ourselves concerning the COVID. But the measures were, the structure was not actually put in a correct way. Because as a country, as developed country, I was in the US 2 months ago. They said social protection because of the COVID. But they provide masks for free. Nobody's buying any mask anywhere. They provide this chanjo in almost every state. They provided a lot, and they were paying their workers without going to work. they are paying those who are not working because they have to eat. So even if there was lockdown, there was a sense in it, you see. But here we have been told to provide to ourselves while we don't have nothing to eat at night. And you will find our police officers arresting the same 70, 60 years people who are going to the market to get their food, to feed their orphans back at home, and put in the police cells, and they need 1,000 shillings or 2,000 shillings. You see, so according to me, I'm talking on behalf of the widows in this country. I'm talking on behalf of the vulnerable in this country. It was not sensible to me to put the message without doing it. As a Ministry of Health and a country which is being governed by the president and the deputy president and the ministers and all the government arms, we should actually come with an outline of providing essential services to all people there at home. I was watching at my TV last night or the previous night. I see over 1 million people in the roadside without mask, celebrating those who are looking for the election move, shouting and campaigning on their election position that they want to win. The same people are going back and they cannot afford to go to Nairobi Hospital or Kenyatta.
Yes.
These people are going back with COVID and most of them are dying. By the time they are in the public rally of politicians, there's no police officer who is arresting any because they are not having taken care of measures which have been put by the Ministry of Health. But after the meeting, when our big fish ran away with their helicopters, when you're walking now into your house with 100 shillings that you have been given there, then you are being arrested and put to the police cell to pay 2,000. The measures were good.
You've contravened the
but I'm against it another way, that we should provide what we need to provide. My friend, we are in the same country. Last 2-3 months, we had a case in court where our government, our people, stolen the money for the COVID-19. I've never seen anybody in court. I only saw some people in the parliament trying to sanitize themselves that they're clean. By the time that money got lost, how many people have died? You are going to the press and telling us you be self-reliant on this. So I like how they said it, as my brother said. We in this country, we do a lot in paperwork, but we do little into the people.
Indeed. And of course, we will be delving much into that, and Doc will be helping us know how we can ease mental pressure now that at least we can say that things are starting to look up. We talk about medication, there's people talking about ventilating by exercises and everything, but at the end of the day, we need to look at this issue in a more positive way, because things are starting to ease up. Let's first of all take a quick break. We'll be right back.
Can I get water?
Mimi naona mwisho atatuletea shida wewe. Since you're all genius, nifanye nini?
Heri nife mimi kuliko nyota mke wangu.
Samahani bibi. Nisamehe, sikujua.
Utabaki hivyo hivyo. Zumbukuku usiyejua kitu.
Haya mambo tuachane nayo. Pili hatuwezi kuachana nayo.
Unataka nini wewe? Mara ngapi nitafanya maneno yangu na ufuati?
Welcome back to News Check. Thank you so much for keeping me company. And of course, with our guest here, we are looking at the socio-economic impact of COVID-19, and especially now that things are slowly but surely starting to look up. What are some of the things we have been able to endure? Something that has affected you, and perhaps you never notice it affected each and every one of us. Also psychologically, of course, economically, and of course, as a country, we are trying to pick up the pieces, and so should you in your life. And Daktari here and Newton, we are trying to put those things into perspective. Perhaps you wanted to add something on the social protection before you tell us how can we ease the mental pressure, because at the end of the day, even if you have all the money in the world, and of course everything is going on as planned, business is okay, because there are some people who have not been affected economically, but at the end of the day they have been affected mentally and psychologically. Daktari.
Very important issue to consider. In terms of healthcare, my view of this is the government has some good ideas about universal health coverage. When this is implemented, then we'll be able to provide healthcare to as huge percentage of the population as possible. As it is now, the number of Kenyans that have access to some sort of an insurance coverage, those working in the private sector, it's 1 million and a few hundred thousands of Kenyans. So less than 2 million Kenyans have access to private medical insurance.
Yes.
The number of people that are covered by NHIF, because their payments are remitted by their employers, working in the public service, in the civil service, in the police force, is equally not a huge number. So the number of Kenyans that have to meet their medical expenses out of pocket, you know, they have to pay for health care directly with their meager earnings, is more than 70% of Kenyans.
Yes.
Which is an extremely unfortunate situation. So I feel that that is one of the vulnerable groups of people that needs to be addressed in terms of healthcare. How? By availing healthcare to each and everyone in the country, if possible. How? The universal health coverage, a very good idea. Implementation, we pray that that happens, and happens quick. Should have happened yesterday. So very important. Then the allocation from the budget, per capita allocation for every Kenyan. When we check the budget, how much has been allocated for healthcare?
Yes.
How much has been allocated specifically for mental health care? You know, for each and every Kenyan. Very important that the government actually ups the game. We have had declaration in the past that a given percentage, more than 15% of the annual budgetary allocation should go to healthcare. Where are we in Kenya? Less than 10% of the annual budgetary allocation goes to healthcare. Goes against the Abuja declaration and all that, which actually recommends a certain per capita and GDP allocation to healthcare. So this will go a long way in ensuring that there is protection of the vulnerable population in terms of healthcare. Yes.
How do we ease mental pressure as things are right now? Exercises and trying to be positive, of course, counselors will tell you all that, and even doc will tell us all that. How do we ease mental pressure?
How do we ease mental pressure? Very important point. Affects each and every person because we are going through difficult situation, difficult circumstances, you know, and it's very important. One, how do you eat? The food you eat affects the mood.
Yeah.
Food and mood are closely related. Are we eating well? Or we are eating junk, you know, taking a lot of alcohol, smoking, you know, using psychoactive substances and all that. So it begins from diet. Nutritionists will advise us that what you eat has a lot of impact on your health status. Garbage in, garbage out.
Yes.
It's not just garbage out because you go to the washroom. It's also garbage out in terms of, you know, how do you think, how do you perceive the world. The brain needs energy, you know. The brain needs good food.
Yeah.
The brain needs good nourishment. So let us eat well. And then two, let us exercise, like you hinted. Engage in physical activity. You know, many people working in white-collar jobs, you know, sedentary lifestyle on the desk throughout the day, engage in some active activity. The recommendation is, you know, at least exercise 180 minutes every week. You know, if you have to divide 180 minutes every week, every single day, then engage in vigorous activity that tires the body at least 1 hour every day. It could be jogging, could be playing soccer, it could be, you know, some people are working in manual jobs, maybe for them that is addressed that way, but get some physical exercise to engage in. And then, of course, avoid stressful circumstances. Try as much as possible to minimize the levels of, you know, stressful things. That is by practicing useful techniques like mindfulness, being aware of where we are, our environment, the things that are going on, you know, taking note of what is the situation that I'm going through and how are we addressing these issues. So mindfulness, how do we sort out the issues surrounding us? And then, of course, there is awareness of bad things happening. When bad things happen, we need a way to ventilate. So right now, we have been going through the COVID-19 pandemic. Where do our people go to ventilate? We are doing that here. We have our churches, we have the chamas for women, we have us, I'm sorry, you know, Man United, River Brook,
Yes, games and
0-5, of course, is -5, sorry, Man United fans. But of course, when you're going for these games, man, don't indulge too much in alcohol, you see. Because this is bad. It's unfortunate that, you know, like in our setup for us, men, you know, these things tend to go hand in hand, you know, as we are spectating this soccer.
So we could end up trying to ventilate, but at the end of the day, we are also putting in some other problems
taking
later.
one too many. So we need to think about all these circumstances, you know, so that we are able to ease the sort of mental fatigue, you know, sort of mental stress that we've been going through.
I'm quite sure, Newton, you can tell us what you've been doing, and especially in the orphanage homes and some of the houses. You built quite a number of houses for widows in your county. And of course, how has the situation been right now for the elderly and people with disabilities, and especially now that the COVID pandemic has really hit and things are starting to ease up? Have you perhaps even gotten any help, or some people chipping in to help those vulnerable, very, very vulnerable, the elderly and people with disabilities?
I have not stopped doing it. I trust in God, and He has been giving me some people who actually still support. Even I'm going back today. Tomorrow I'm sure of building another one house. Next week I'm sure of building another 2 or 3 houses. Even though we have been reaching a lot of challenges, as we said before, but we still have some good people who can say, okay, it is difficult, but let me share whatever little I have with other people who don't have down there. You know, there's something that I wanted to emphasize on or to push both politically and development in the community. What I'm doing is development in the community. We are going back to the people and to give back to the community. The money that now we are using in Kenya for campaign is more than enough to build the houses and support the widows and the orphans in the entire country. But we are using it to win the seats. While some people outside the country who are not even interested in any political office are busy sending us money to build and to support our own children, our own women, our own mothers in this country. I'm sure it's not even bad if I say shame on us. Because tomorrow we will wake up and go do voting for our good leaders from the MCA to the presidency. But after election, after the date of election, nobody will think that there is another widow, elderly, and a grandchild to the orphan who is living outside without a shelter. It is not easy, and I will stand in, my brother. I will stand and I will speak the truth day by day to the widows of this Republic of Kenya, to the orphans of this Republic of Kenya, because we are always forgetting about them. I'm requesting our members, our fellow members of this country, that even though it is difficult, can we share? Can we share? We had pandemic, we had issues, they are still alive. I was having a case in Guasi, Homa Bay County, where that lady is around 70 years old, living in something that we cannot call a house. If you're inside the house, you see the sky. If you're inside the house, you see whoever is walking outside, and the house is by the lake. And this grandparent is having 2 grandchildren who are orphan in the same problem. If you're talking about the mental issues, what do you think these children are undergoing in such kind of a situation? What do you think this elderly mother who is a widow is undergoing with her own grandchildren, surviving with her without food, without no house, without no bedding? I want to say that I thank those who have been supporting my organization from the United States. I thank them, and may God bless their pockets.
No one is helping you from right here in the country, Kenya?
Maybe 2 or 3. I can only mention there's a guy, my friend called Maurice. He's running a big organization like what I'm doing. It's called Mana. Mana Ministry has been feeding number of less.
It's a ministry, not either business people or politicians.
No, the politicians always need their portion. They help you to give them vote, and you will never see them. I've never ever called even them into my organization, because I know what they want. Their faith there is not to help, but their faith there is to challenge my mind so that we can get them vote. But the ministry, the man I'm talking about, has been doing a lot in this country. This guy, whenever I call, when I'm in need, he always supports me. There's a ministry called Gideon's. Gideon's is located in Kabondo. The brother there is called Newton Onyango, as my name. Is doing a big and a wonderful project there. He's having over 100 orphans. He's having a number of widows. He's feeding the community. We work with him together. This guy is really supporting, even if you don't support my organization, but support the same people that we are supporting. We have some other small organizations which are coming up with the same motive of work. But the senior people in this country, unless if they want to support, they go to gathering, then they give 1 million, 2 million, 3 million to be shown in the TV or to be announced. But I want to thank those who have been supporting us, because even though we had a pandemic, we have been still reaching. 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 Even now I'm building a dormitory for the orphans and the kids I have at the orphanage. And I still have some people who support me to build it. So they have not stopped because of pandemic, but only the challenge I have, the limit is not now the same as before. But we are still working out. Yeah.
Indeed, and of course, Newton is a good job that you're doing. We've seen some of your work, and of course, when the COVID-19 pandemic, I do remember hit us. You said you're not gonna stop on that. And for now, let's first of all go to Kibera Primary School, where the CS for Public Service and Gender, Margaret Kobia, is launching the Stop It Report It campaign in Nairobi. Of course, it's a national public behavior change campaign, and she's joining, she's actually launching it right now as we speak. Let's first of all hear what those guests there have to say.
We have today, proudly I would say, managed to take 440 students or young people from Kenya to Israel through this program. And it is a reason today that we have the largest single cohort that is going to Israel for advanced studies in agriculture, comprising of 200 young men and women. At this point, allow me to also remind these students how I look. So the rest of it, I'll speak to you like this so that then we can communicate properly. Allow me to recall His Excellency President Kenyatta did make a successful state visit to Israel in February of the year 2016. And it is his visit with his host, the Prime Minister of the State of Israel, where they made a reciprocal state, who also later made a reciprocal state visit to Kenya the same year. Then the two heads of state did agree to get into, or to strengthen or to deepen the relationship between the two nations by signing two agreements. One was explicitly touching on training and capacity building in water and irrigation, which is now the famed Agreement on Water Resource Management, Technologies, Irrigation and Capacity Building. This was followed also by the second agreement, which is a Declaration on Collaboration in Water and Irrigation, also known as the Jerusalem Declaration, which the two heads of state entered into in February of the year 2016. It is the reason we are here today, because the two heads of state did express in very certain terms that they would like to deepen the relationship, and in the process they would like to have a very focused attention around capacity building in the space of water and irrigation. We could say the rest is history, because we have since grown from strength to strength, proud of the 440 students or young men and women who have since benefited through this program, which has indeed given us more flavor, more color, more skills, more resolve to develop the agriculture sector using current technologies, skills, and also imparting, like my colleague from the university has indicated, skills that go beyond agriculture. You're proud. I'm proud of you. You're lucky, and I congratulate you, because we have thousands of students who would have wanted to be in your shoes today. But for me, it's a conversation I've just had with Her Excellency on how we position ourselves to create or to build a critical mass of young men and women who would then ensure that this sector is not viewed as a sector where we only have old people. The other day I met an old friend of mine who has since retired. He's a lot older, but he has retired. And I met him, and he said, "Waziri, I need to come to your office." And I said, "Yeah, welcome." And I said, "What would bring you to my office?" He said, "You know, I've retired. I want you to give me land and skills to be able to go into farming." It is you who will make somebody like that tell me I'm coming for a cup of tea, and I'm coming alongside with my son or daughter so that they can move into farming. It is what you do with the knowledge and how you expose the same that is going to make my friend tell me my grandchild who is going to university is probably going into agriculture so that he can set up an entrepreneurship enterprise, as opposed to going there because we have retired. I'll be brief in noting the following. While knowledge and imparting knowledge is the starting point of this program, the end game of this project is for you to have practical skills that will enable you, the young people, to venture into self-enterprise in the space of agriculture. Granted, of the 440, a couple of you are already working in the private sector, in consulting, in the counties, back in the national government. We celebrate those of you who have actually turned their knowledge and skills to be something beyond a white-collar job, that you have set yourselves up. And I really celebrate the alumni that has managed to venture, because the intention of this project is not to give us more people that come to look for jobs in Maji House. It is for you to go out and set yourselves up, train other youth in agriculture, apply the sophisticated skill set, and be able then to carry forth with the agenda on food security by His Excellency President Uhuru Kenyatta. I'm very happy to note that those of you who have come and moved into agripreneurship are already in profitable farming enterprises, using the skills that you have gained. I'm happy to note that in Kajiado, in Kisumu, in Migori, in Kiambu, just here, in Meru, in Tharaka Nithi, in Narok, in Siaya, we have the alumni out of this project doing extremely very, very well. I'm further proud of yourselves, and this goes to you who are involved in the selection process, that the students who have gone to Israel before you have brought home special merit awards because of outperforming the rest of the students from other countries. My challenge to you, young people, bring more medals. I think the count I have seen is not good enough. Bring more medals, because that is what Kenya is made of. You will meet colleagues from other countries, but given our appetite to develop the agriculture sector to be that more productive, to be the employer of choice, to be producing stuff for the export market like we have done, and remain top of the export markets, it will require you to come home initially with those medals, because I have no doubt the selection process has distilled those of you who will be able to do this. To you, Madam Ambassador, take our appreciations back to your country, to your Prime Minister, to the teams that are coordinating this project for us in Israel, telling them that the team that comes back home does come home with professional, theoretical, but also practical knowledge that is making a difference in this country. And that indeed, the approach that you take of learning by doing is exactly in sync with His Excellency President Uhuru Kenyatta's appetite to develop skills for particularly these young people. We look forward to scaling up this project. We look forward to working together with our partners. We look forward to creating the critical mass that is going to give us what agriculture in a modern setting or in the 21st century ought to be. And it will be because of the effort that you put. Wishing you the very best as you travel. Wishing you a very fruitful stay out in Israel. Committing. And the PS is already preparing my ticket that I will actually be the first to come and see what you're doing. I may not wait for what Professor Kiama will do, because Professor, and I recognize you joined us, you will be going to do the midterm review. For me, I will do what I am employed to do, walking about and doing my impromptu thing like I do with a project. This is my project. So I'll be able to make an impromptu, even as I see whether your prayers have begun yielding, as a PS has told you. Allow me, in keeping with the protocol, recognize Professor.
Indeed, that is Water and Irrigation Cabinet Secretary Cecily Kariuki, not Margaret Kobia, there at Kibera Primary School. Of course, launching that project, the Stop It campaign there. And of course, the campaign, guys, to tie what she's been talking about and what she's officiating, is that the young and the vulnerable continue to face all the challenges that can come at a worst time. Like now we are having COVID-19, and a lot could be done by even county governments, as Newton, you had put it, but a little seems to be done. Talking about a girl who was found in the forests, having been defiled and left for dead.
This is the situation we are in Kenya, and I only talk about the one who was found in the forest, which I know it was in Homa Bay County. We have many others who have not been found. We have many others who are struggling. We have many others who there's nobody to stand and
the others who haven't
speak.
Even reported, because the numbers of those who report cases of perhaps of rape, of defilement, of mistreatment are very few.
We have the girl child ministry, I don't know how to put it, in this country. And we have women, like all the women rep, I think they should stand for the women, for the girls' right and the girl child. But I don't see anything happening, because number one, you remember the president announced that the chiefs will be responsible for the girls who are pregnant during the COVID.
Yes.
Because I don't know how the chiefs were getting involved, but because they are leaders of the community. But this is not about the chiefs or about the president. This is about the women leaders, because they know the language they should speak with the girls. Even now, that is the incident which occurred in Homa Bay County. The girl who was found in the forest. I've never heard any women representative talking about it. I've never heard anybody standing in, coming here to the TV or going to the hospital to check how she is managing herself. Nobody knows what she's eating there. Nobody knows where she's getting the medication. We only heard about the news, and we can see people going to the stage and talking. But there's a very big need in the circumstances of the girl child, girl's right, the boy child. They are there. And we need to speak about these things and find the solution. I've talked about the counselors. I think we need to have or to add counselors in various communities. We need to have them in schools. We need to have them in churches, so that we can reduce the early pregnancy. I was talking about the widows, the orphans, and the single mothers. What is it bringing a big number to have a single mothers in the country? Because somehow we don't have socio people who can actually wake up and think of talking, have a talk, have a health talk, have a social talk with our boy child and our girl child. But now it's actually the truth that we already failed, because we cannot even put the percentage of how many underage girls who are pregnant today and having children. We cannot talk about it. And this thing affecting the old mama, the Wanjiku in the community, because you are there with your girl who is around 15 years old, and she's coming back with another child who is 1 day old, and maybe your grandchild is an orphan. You know, so the poverty continue coming up because we have not taken it serious. Like up to date, the girl I'm talking about who is in Rachuonyo Hospital, she's unknown. We don't know where she's coming from. We don't know even after if she gets better. We don't know where we are taking her. Because there's no any family who was to actually come and witness that is their child. Those who have been coming, that is, they don't know. And when they come, they don't know, they just go. So there's a gap in between the poor and the rich. There's a gap between the leaders and the people that they lead. There's a really big gap that I don't even know. Like my brother talked about, it's called Kivuta Kibwana.
Yeah.
If the person that I'm seeing is suitable to lead the country is him, because already he has proven to us that this little money is getting to his county is more than enough, because you have done what we have never seen in this country since we have devolution. If I go back to my country there, I think I have nothing to count on from the county government, even a single thing. I don't know what to count there. Even if I go to the neighboring counties, they have not done much. Like, let me talk about my county, because that's where I belong. Our referral hospital in Homa Bay, there's nothing there. We refer our patient to Kisii or to Kisumu. Is it that the county government of Homa Bay is not getting what the county of Kisumu is getting? That's a question. And it's not about only Homa Bay County. We have other counties around here, which you don't even know if they are getting the same. But my advice to our people, and as per my opinion, because me, I'm not joining politics, but my advice to
that was
people,
my next question, whether you have any political ambitions perhaps you can try and change things.
If the way they lead is the way that I'm going to lead, then I better stay in my organization. Okay. I'm doing much better when I'm outside than when I'm inside. So because even if I join the politics tomorrow, I'm going to get the same people. Some days, our friend, this guy, he said about nyani ni nyani, the monkey is the monkey. The problem is that they can change the forest. Yes. But they're still the same, you know? So even if I join politics today, I will not do much. Because number one, the corruption is already there and nobody is being jailed. And I don't want to be counted under the same. So what I'm trying to urge those who are interested in politics, that even though you are going to earn your salary, can you think about those who voted to you? Now I told you before, now everybody is telling us about registration of the voters. You will see the mental cases that I was talking about here being and those who cannot walk. You will see them, we take them to the centers to get the votes, to vote who and to vote for what. This time we are telling our candidates, we want to vote for change. We want to vote for the person who will actually come back to the community and understand the fate of a widow, of an orphan, or of a single mother, and the fate of our children. For example, why do we have many orphans and many widows in the community? Number one is health. Number two is AIDS. AIDS is actually in the line of the health. Our women sometimes are getting involved in such cases because they have nothing to eat at home. Our girls who are getting pregnant, they are being impregnated with youths or the motorbike riders or those who are just hanging around because sometimes they have been given 20 shillings to buy their pads.
It's true.
What is happening with the leaders or the women in the power? The Constitution of Kenya talked about we bring about electing the women reps. Why did we elect them? They have enough money. But if I ask them today, what have they done to change the life of the girls who will be tomorrow the women leaders in the community? The best they do is to make sure that they push them down to the ground so that they remain in power. But here, the truth is, Kenya belongs to all of us. The children belongs to all of us. So my request to our country, or our leaders, can we swallow our pride and ambition to get into power and to go back and look where we came from? Indeed. That is my mission.
And Doc, perhaps you can chip in with perhaps what has just transpired about the vulnerable communities. And I do remember health practitioners have for a while now asked for a health commission which will take care of, among other, some of the issues that we have been grappling with for the last couple of years. Do you still believe it is going to help? It came up with the BBI. I don't know how it can be actualized, but at the end of the day, do you still believe that a health commission will try to address some of the issues? Because at the end of the day, as Newton has put it, and I know as a parent, is that very well, kids always are sick when you don't have money. And if you don't have a cover, it brings a lot of problems. Yes? Daktari.
Okay. We have to admit that a lot of policy issues, a lot of rules and regulation, and how the government works in Kenya has changed a lot with this devolution situation. In the past, all healthcare was centralized in the Ministry of Health. Decisions were made centrally about hiring healthcare workers, about deployment of healthcare workers, about allocation of resources, about construction of new hospitals and all that. Devolution has its promise, and in some places devolution has worked. Called a spade a spade. In Kifuda Kibwana's county, it has worked. If you go to Kakamega, the governor for Kakamega, that should be Oparanya. You know, you can clearly see some things that are happening here with Charity Kalikugiru. You know, you can see, well, in Machakos we saw ambulances, but it's unfortunate, you know, ambulances are for carrying sick people. Why are you not treating them? Why do you have to carry them elsewhere? Treat them where you are. So you see, well, was it showbiz? We no longer see those branded red and blue ambulances. So it's about politics, but at the end of the day, politics is about the people. And politics goes a wrong way. It has been discussed for centuries. You know, from the Greek philosophers, Plato, Aristotle, they were always asking, how do we get the best kind of leaders? Maybe it is when philosophers are leaders. Well, even the Jews, they were waiting for their leader, Jesus Christ. They expected a leader who will
have big offices, you know, and everything. Yes.
Even the Muslims with Muhammad.
Yes.
You know, it's about leadership. But then, where the tire hits the road is that today and now, in our hospitals, we need medicine, we need doctors, and we need all that. Is it working with devolution? Yes and no. We have a lot of teething problems, and one of the recommendations that has been put forward is that we need to decentralize healthcare, which is where a health service commission would come in. We have commissions for different things in Kenya.
Yes.
You know, the task force has for mental health actually recommended that we need a commission for happiness, you see, to measure the happiness levels of Kenyans. You know, how happy are you? How happy am I?
Yes.
We need a commission for that. You have the Teacher Service Commission. But despite that, we have been having all those strikes by the teachers going back many years. You know, we have other commissions for X, Y, Z, A, B, C, D, all the letters of the alphabet. So are they working? Each commission has its mandate stipulated in its in its formation and by the Constitution, the Judicial Service Commission, Police Service Commission, and all that. Do I feel that healthcare needs that? Yes. Why? Because this is a unique service in the country. And despite being unique, we have a limitation in the number of healthcare workers that need to be deployed. So whatever we have needs to be shared. You know, between Machakos and Mombasa County, between Kisumu and Wajir County, between Turkana County and the other county. But now when everybody is running their own show, inequalities happen, which is why Homa Bay will refer its patients to Kisii or to Kisumu. There is no measure of bringing in some level of equity and a rational distribution of healthcare workers. So this needs to be addressed. There is a promise for the formation of a health advisory commission, you know, having a director up there to rationalize all these redistribution. But the feeling is that a health service commission will perform this purpose quite well. But besides the point, we don't need to lose also the gains that came with devolution. How? That, you know, these resources are trickling down to the grassroots. So it needs a lot of prudence, a lot of self-giving, a lot of morality and ethics. You know, I wish we could have a way or a school that can teach political ethics and political morality, because it pains me, it pains you, and it pains anyone when you go to a county somewhere, and I can give specific examples of counties where I know I, as a doctor, when I go to that hospital, if I prescribe medicine, patients will not get medicine. Why? Because money that was meant to procure medicine was redirected to something by the politician and the cronies and the Cross family, you know, to their own pockets. And we can pinpoint, you know, this house was built here, this shamba was built here, and most likely it is proceeds of corruption, of money that should have been directed to the public good. You see, it's quite unfortunate. and it pains Kenyans. And I feel it's about ethics, morality, and the kind of leadership that we have. We have a crisis of leadership, and I don't know how we are going to enlighten our society and our leaders to change about these things, because it is shameful, honestly. It is extremely shameful to know that a governor is misappropriating resources, and because of the misappropriation of resources, people are dying. No.
Indeed. And Newton, you raised that issue a while back and said that, of course, you will find that these people will not seek treatment here. They're going to seek treatment elsewhere because they have at least the funds or the cover that they have. But the vulnerable, and especially now that we have COVID, they will not get that chance that will be told by Daktari, I recommend this medicine or I prescribe these medicines, but you cannot get them here. And that is a serious problem when it comes to health matters in counties.
You know, number one, we have health workers, we have government workers entirely. You will find they're being deducted the remittance to NHIF. And when they go to the hospital, they will come back without treated because their remittance were not channeled to the NHIF. So you're being already deducted and it is not there. That is number one. Yes. So it's not about even the vulnerable alone. It's about the management in this country. Sometimes I cry and I say, better we go back to the national government because the county government has failed. Because the money has been channeled to the county and 2 or 3 people are using this money in a wrong way. But my problem is one. I've never seen any in court being jailed for 10 years in using public funds in a wrong way. I've never seen one. If you have seen one, tell me. There is no one in jail today, but we have number of thousands of people who are being jailed because they steal chicken or they have steal something simple. So I don't know how the government or the president been taking this to. Because, for example, now if I talk about the county government issues, it is not worth to be discussed because there is nothing in the ground. If I'm not talking about the person who now cannot afford the health care, but this is the person who worked for it, is being deducted, but the money is not there in the NHIF system. When the COVID came, they said the NHIF is not covering the COVID patient. The COVID patient has been paying the insurance. I want to talk about those who can support themselves.
Yes.
Then where am I going to get? I'm being paid 20,000 a month. They already deduct my money for my health, and then the COVID now is not a disease. It's something that cannot be treated with the same health cover. These people, one time I said, they can go to outside the country and get treated and come back with billions of money, which is our tax. And they refused to go back and support our own children, our own orphans, our own widows. I said here before that I will stand in for the widows. I'm now start looking how I can actually register a number of them into NHIF and look for money to pay for them. Because number one, we have some deaths which are actually occur because of simple things that we can, like the way the doctor said. You prescribe the medicine and the medicine is not in the hospital. I have a patient now at the hospital, the lady that I'm talking about. I'm buying medicine from outside or I source from my hospital to go and be treated, my patient at the hospital. I'm even buying a gloves, just a gloves. Do you think they can be referral taken to that kind of an hospital? No. The referral are now being taken to private hospitals or we go to other counties. When my people goes to other county referral hospitals, they're being frustrated because the other counties are asking, our hospital is full. And we have been given the similar amount of money that you have been given. What happened to yours? Then most of the patients are now dying because of such kind of, I do call them stupidity. You know, you're going to eat from the neighbor and you have the similar food in your house and you cannot cook it. So I'm just urging the national government, please, the incoming president or the current president, whoever is going to seek for any power, please can we sit down as Kenyans and we strategize on how we can change this management of our resources. Number two, we need somebody who is in charge for the widows and the orphans in this country. We need to know it's who that we can approach and talk with. We need to know who is standing in for the girl child the girl right. We need to know them. If they cannot afford, then let them uplift the private sector to be given the chance and the power to handle and to manage this kind of problems in the country. And that person must be given their location so that we can reach out in the grassroots. Last time I said, reaching people in the TV is not enough. Announcing what the government is taking to the country is not enough. Can we have people going to the grassroots, working with the assistant chief, working with the village elders, so that we can reach a person who cannot even afford to buy a battery to listen to what is being announced at the radio or at the TV. So I think, my brother, what we want, Njue, is to make sure that we localize a lot of things and have a talk. Even with the, I've been urging to meet the president. I don't know how I can meet him, so that we can talk one-on-one with him and we can address these issues, because I know there's no president good as Uhuru Kenyatta. I'm telling you the truth. I've never met him, I've never greeted him, but I feel that he has the people's heart. His heart is big to carry everybody. But the people surrounding him are blocking him to reach the people that he need to meet and talk to.
Of course. Yeah. Dr. perhaps you can add on that, and because of the interest of time, there is a question. Of course, it's not quite related to what we are talking about, but we have seen situations where, and working at the courts, where before you're charged with murder, you go for a psychiatric evaluation. Can you briefly tell us exactly what happens in that psychiatric evaluation, if you don't mind?
Okay. That's quite a technical question. This is what happens. We have a field called forensic psychology. This is where law and psychology, if we call it that, and psychiatry tend to merge. And how do they do that? That a lot of the things that people do, it's about human behavior. You know, when someone commits a crime, it's essentially human behavior gone rogue. Okay?
Yeah.
And there are very many motivations for anyone to commit a crime. It could be premeditated, okay? Or it could be an event that happens at the spur of the moment. It was not premeditated, it just struck someone. Let me give an example. It could be a bit off, but it's a man, he's gone home, coming from work, late in the evening, found that there's another man in the house, and the wife is there, they're in the bedroom. In a fit of rage, the man picks a knife from the kitchen and stabs the intruder. You know, it's a fit of rage.
Yes.
Okay. Another situation, a man has a debt of another man. He has been asking, repay my debt for so long, but then the debtor is not paying. And this man is seething with anger and resentment, and he decides to go look for a gun and meets the debtor in the streets and shoots him. Well, he's had all the time in the world to think about it.
That was premeditated.
So it was. But then now, these are two people that have been put in the remand.
They have come to Mathare and you are the doc, yeah?
No, they will first be arrested by the police. You know,
of course, they will be taken to court.
They will be taken to the cells, and then they will be taken to court, arraigned before a judge. And the police, the prosecuting officer will taper down the evidence. He did this, he did this. And then the judge has to weigh the evidence that is presented. But then now, how does the court decide? Why did this event happen? So that is where the issue of mental status examination or forensic evaluation comes in. And it can only be done by someone who is skilled in that. The doctor or the psychiatrist will go and evaluate this person and find out what was the milieu, what was the environment around that event happening. Or even if it is not around that event, what is the general mental status of this person? Which answers your question, what is mental status examination? Essentially, you know, it is one thing that I think we need to wake up to, that we play soccer with our feet, you know. We run, our athletes go and run on their feet. But at the end of the day, our brains, our minds are very complex and interesting organs. And every single thing that you do, it boils down to the brain. How you think, how you feel, how we make decisions, how we make choices, how we make judgments. It's about the brain. And the brain needs to be in a good status for thinking, for perceiving the world, and that is exactly what happens when the patient goes for mental status examination. As a doctor, I want to find, how is this person perceiving the world? How is the cognitive status of this person? How is the judgment and the decision making? How are their feelings, thought, and emotions? And what is the influence on their behavior? Can it be said, this person committed the crime because, well, they were not in the right state of mind?
Of course, that's another discussion for another day. Your final comments, Newton?
My final comment is we need to change the country in any way we can. Number two, I'm urging for the officials, the government officials, to do good in their areas of work. Number three, I am asking for the president or the presidency or the management there to take care of all the country and make sure, this is my request to them, to meet with the private sectors, NGOs who are working down there, so that we can bring our agenda to them. So when they are campaigning, they are doing all the things that they do, they listen to the other part of the private sector, the challenges that we are getting and what we are going through.
Okay. Daktari, final words, 30 seconds.
Thank you very much, Misheni, for inviting us here. I'm happy that our society is awake to this conversation that we are having about what is the socio-economic impact of COVID-19 on our society, on ourselves, on our children, on our vulnerable people. And then we need to continue this conversation going.
Yes.
Everyone out there, be thoughtful, be aware about the mental health, wellness of yourself, your neighbor, your family, and everyone in the society. And let us fight shame and stigma, and let us enhance the mental health of everyone.
Thank you so much, Dr. Leonard Njiru. Incidentally or coincidentally, we were in the same class 21 years ago.
21 years ago.
Yes, of course. He became a doctor. I became a journalist. And Newton Ogada, philanthropist, thank you so much for what you do and for creating time, gentlemen, for the show. Indeed, you have been watching News Check, and we have been looking at socio-economic impact of COVID-19. And of course, it has affected each and every sector. But now we slowly but surely picking up the pieces so that we may be able to go back to our normal now. We had a new normal. We want our old normal and better than what we had before COVID-19. Thank you so much for watching. I'm now giving rise to my colleague Gladys Mungai, who will be coming up with Tamrini after she gives us what is the latest in the news in Kurunzi Mashinani. Thank you so much for watching. I'm Bentroy Njue, and Anwangeshi has been our sign language interpreter for this show. Have a good one.